All right, readiness assessment part 1. So let's go through this pretty quickly. Medicare infrastructure readiness. We've already talked about this at length. In order to directly participate in Access, you've got to be a Part B provider. So if you're asking the question, how ready am I to participate in Access? Ask yourself, do I already have a Part B enrolled TIN or NPI? Do I have a PTAN number from Medicare? Do I know how to submit claims and process them? That'll give you a good indication of how ready are you from the Medicare Part B perspective to, again, directly enroll. If you're a digital health company, you can skip that one. You don't need to be enrolled in Part B. You might instead ask yourself, are my customers enrolled in Part B already or not? And that'll give you a good sense of, from the Medicare perspective, how ready are you? The second thing, the legal and governance framework. So again, if you want to be a provider, ask yourself, do I have an MSOPC model in place if I'm a digital health company? Do I understand, what a medical director has to have control over versus what I, as the digital health company, can have control over? Do I have a solid HIPAA framework in place, privacy and security? Do I have high trust or SOC 2 type 2 or not? Those things aren't necessarily required, but if you already have them in place, you're certainly going to feel more ready to comply with, privacy and security concerns that come with being a provider and working in healthcare generally, I guess. Do you know the FDA status of your tools? Do you have medical devices? Do you not have medical devices? If you aren't sure, do you know about the FDA's recent updates to their general wellness and CDS guidance and how that's going to apply and impact your status? Have you looked into all of these things, right? A lot of this legal and governance framework is, there's not necessarily a one size fits all where you have to have one specific legal infrastructure or governance framework in place. But have you thought about it? Have you already implemented a framework? Have you sort of said, well, we're really new, so 6 months from now, we'll come back and revisit these 3 things. And for now, we're just going to move forward. That might be a risk for you if that's the world, if that's sort of the status that you're at right now. So have you thought about these things? Have you started to build the framework, and then have you implemented it? Or maybe are you just sort of at the ideation stage? Luis, I'll kick it to you to talk about the technical compliance and the operational and financial considerations.
Yep. So we covered in this presentation some of the technical capabilities you have to have in place. Your fire standard APIs, your ability to capture the biomarkers, establish abasement and demonstrate improvement or control over those biomarkers. We talked a lot about some of the information sharing that has to happen with Medicare and among providers. All this has to be set in place when you go live. Beyond that, we talked as well about operational care capabilities. What's your process in place for capturing these data points? How are you sharing this data in a timely enough fashion that your clinical partners can have them be actionable? How are you communicating with your patients? How you are ensuring engagement with patients with regard to your access solution? All of these are operational capabilities that need to be established ahead of time. And then finally, from a financial diligence and risk modeling perspective, how are you basically fundamentally handling the fact that you aren't going to see at least half of your payment until the end of the year, even if you completely kill it? How do you handle the fact that you might not see that full 50% and that the 50% that you do see is distributed on a quarterly basis? And so with all that financial withholding, how do you then structure a business model that makes sure you have the capital you need to working capital you need for ongoing operations, while also perhaps establishing relationships with critical outside partners along the lines that can help really drive success within this model?
And how do you make sure that your board understands that, right? That your board understands what risk you might be taking and how you can give them assurance that you're going to get that additional 50%, or you're going to do the best that you can to get that additional 50%. Or if you're a digital health company, right, you're sort of trying to manage for the fact that your customers are only getting 50% upfront. And how do you tell your board, hey, we're going to have to take a lower amount upfront, and these are the things that we're going to have to achieve in order to get that additional 50% or whatever amount it is that you're charging, making sure that internally you feel good about the risk, but then also how do you explain that to all of your stakeholders as a company to make sure that, you've got enough runway to survive, and you also can give, can quell any concerns that your board or investors or whoever else may have about that piece of it.
Yeah, good. Excellent point.
All right. Part two is the clinical readiness assessment. This is a little bit sort of higher level, speaking specifically about the clinical readiness. So, Luis, do you want to go over this at a high level?
Yes.
So add along the way too, but.
Yeah, as we went through, given our work in the past with digital health companies, we thought it was helpful to kind of break out separately. What are the things clinically that need to be done to make sure that that you're succeeding in access? And so this is just a highlight of a few of them. There's a long laundry list that we had of items that folks need to have in place. So having basically the ability to do telehealth visits with a patient, face to face with a provider if necessary. How do you establish that capability? Keep in mind that you're doing this with a traditional Medicare population. So how are you going to get it to work for those folks? How are you going to make sure that your devices or other supports that you're using to capture the biomarkers are set up? They're capturing the data correctly. They're reporting the data at the cadence that your solution needs in order to deliver results. Those are important. How are you providing holistic care options to patients? Lifestyle support. We talked about the fact that many of these conditions are comorbid with behavioral health conditions. How are you making sure that patients are not doing the no-nos? They're not smoking, that they're getting their exercise, that they're not going to McDonald's every day. How have you got your clinical support staff trained so that if your model involves intervention from care management staff, that they're able to pop in and help the patient and do so in a meaningful fashion? And also important is highlighting some of the educational and social aspects of healthcare, the social determinants of health that can really drive success or lack of success with these models is important. How are we sure that these patients aren't experiencing extreme loneliness that's driving them not to want to continue their treatment? That they are meeting their PT appointments, if that's part of your MSK Solutions ability to deliver success for patients. So all of these are all clinical capabilities that folks have had to figure out already, but you're having to connect a bunch of these different dots within Access. And they all have to be operating on all cylinders in order to be successful. Anything else to add there, Kaitlyn?
Well, I would just say that, this might be, I work a lot with remote monitoring and care management companies, but I think this slide in particular, if you are sort of at that fork in the road that we started this conversation with, where we said either you can be a provider and set up the infrastructure there, or, remain an enabler where you are just selling to providers who are participating. If you don't have all four of these particular sort of categories figured out, if you are a remote monitoring company and you can help with continuous monitoring and oversight, but you don't have a telehealth platform, you don't have connections with specialized therapies, you don't have, patient education and SDOH assessments and partners that you can, community support organizations that can help alleviate the impact of social determinants, you might not want to go down path one, right? Because we already talked about needing 4 to 6 weeks just to get the legal infrastructure in place. It will take even longer, most likely, for you to have this clinical infrastructure in place. And so and that's, I think, part of why we wanted to keep this as sort of a separate part or a its own sort of standalone piece of that readiness assessment, because you might feel great legally, operationally, financially, but on the clinical side of things, that is arguably the most important part of this entire readiness assessment. Do you have all of the clinical capabilities that you will need in order to be successful in, your legal once you have the legal infrastructure, the financial infrastructure, and the operational infrastructure? So, think about that. Like I said, if you're that digital health company where you're at that fork in the road and you're like, should we move really quickly and try to be a provider and directly participate, or should we sort of stick to the enablement lane? And you look at this and you're like, ooh, we only have one out of these four, or ooh, we have part of one of these and not the others, or we have three and not the fourth. It may not be the right time for you to try to approach that path one. You might want to stick to path two, stick to the enablement side, collect data, build out the infrastructure, and then look at maybe the next application cycle as the right time for you to apply. So that's sort of my final thought there. As a reminder, we will include a sort of self-serve readiness assessment, so you can go through this on your own and really think about where you are now versus where you would need to be successful, in our opinion, and based on the rules and the what we've seen from CMS thus far. So check the maybe in the show notes or a link that shows up on the video. So keep an eye out for that. And of course, feel free to contact Luis or myself with any questions that you have. Okay, so that wraps things up for our crash course on Access. We want to say thank you to everybody who has made it this far and who's been following along. And keep an eye out for any follow-up and let us know if you have questions. Any final thoughts from you, Luis?
Kaitlyn, really appreciate you sharing your insights and was really grateful for the opportunity to talk a little bit about Access. We think it's an exciting model, so don't hesitate to reach out, as Kaitlyn said. We're more than happy to dive really deep into any of the topics that we've talked about in these past 2 sessions.
We'll leave it there for now. Thank you, everyone.
Thank you. Thank you for joining us and exploring the details of the Access model. We invite you to watch our other videos on the basics and paths to success in the Access model. We welcome outreach if you have any questions.